Hello, everybody. I am Dr. Nadeem Murtaza, medical specialist and nephrologist from the platform of my YouTube channel, Margalla Calling. Today, we are going to discuss the need for multivitamin and supplement use in our normal, healthy adult population. We'll not discuss their use in pregnancy or in children, or the counter availability of multivitamin and supplement use in our normal, healthy adult population is increasing day by day, and their easy availability, favors the rise in their sale and consumption. Judicious use of multivitamin and supplement in our region should be goal of medical practitioners. This is possible only when medical practitioners are themselves convinced when to prescribe and when to avoid. Recently, I came across a notification on the website of the PMDC. This was notified on 29th February 2024 on their website. This is still present on the website. According to this notification, Pakistan Medical and Dental Council is directed to prohibit prescription of all vitamins, multivitamins, minerals, and health and over-the-counter products by physicians, doctors, medical and dental practitioners, and to take all necessary steps forthwith, including amendment, if any, code of practice and ethics for the medical and dental practitioner under section so and so. The PMDC's council has directed all concerned to ensure compliance of the cabinet division's orders. This issues with the approval of the competent authority. This is still valid. It has not been taken back. I searched the medical journals on this topic. I found a lot of material and I'm quoting the most authentic on the use of vitamins and mineral supplements. That was an editorial published in Annals of Internal Medicine on 17 December 2013. Enough is enough. Stop wasting money on vitamins and mineral supplements. That was back in 2013. In this editorial, John Hopkins researchers reviewed evidence about supplements, including three very recent studies. Three articles were published in this journal in the same volume in which the editorial has mentioned. Three articles in this issue address the role of vitamin and mineral supplements for preventing the occurrence or progression of chronic kidney disease. First was Fortman and colleagues. Second was Goldstein and co-workers. And third was Lamas and associates. You can hit this link to get this editorial. This review article by Stephen P. Fortman and Associates regarding vitamin and mineral supplements in the primary prevention of cardiovascular disease and cancer. An updated systemic evidence review for the US Preventive Services Task Force that was also published in Annals of Internal Medicine on 17 December 2013. This is an analysis of research involving 450,000 people, which found that multivitamins did not reduce risk for heart disease or cancer. This original research, published on 17 December 2013 and quoted in the editorial of the same volume. That's 17 December 2013. This is also called as the Physician's Health Study 2, and in this study, centrum silver was used against placebo. The Physician's Health Study 2 tracked the mental function and multivitamin use of around 6,000 men aged 65 years or older for 12 years found that multivitamins did not reduce risk for mental declines such as memory loss or slow down thinking. On 16 December 2013, New England Journal of Internal Medicine in its Journal Watch quoted the editorials of the Internal Medicine and wrote, "Case closed, multivitamins should not be used." Prospective cohort study published in Annals of Internal Medicine on 19th April 2019. That was on association among dietary supplement use, nutrient intake, and mortality among US adults. Background of this study was the health benefits and risks of dietary supplement use are controversial, and its objective to evaluate the association among dietary supplement use, levels of nutrient intake from foods and supplements, and mortality among US adults. 30,899 US adults aged 20 years or older were the participants, and the outcomes included mortality from all causes, cardiovascular diseases, and cancer. And the conclusion, use of dietary supplements is not associated with mortality benefits among US adults. There are many other reviews and guidelines published in various journals and reviewed in New England Journal of Medicine and Annals of Internal Medicine. I wanted to remind you these studies are in the adult US population, non pregnant, and not suffering from any other chronic diseases. Many of these reviews and guidelines mention that the role of vitamin and mineral supplements in primary or secondary prevention of chronic diseases have consistently found null results or possible harms. Evidence involving tens of thousands of people randomly assigned in many clinical trials show that carotene, vitamin A, and possibly high dose of vitamin A supplements increase mortality. Other antioxidants, folic acid, and B vitamins and multivitamin supplements have no clear benefit. In spite of all these studies available in the literature, still most of the Americans they consume these multivitamins and supplements, and their number is increasing. As per CDC health statistics, dietary supplement use among adults in United States from 2017 and 18. This is the first figure. The percentage of adults aged 20 and over who used any dietary supplement by sex and age in United States from 2017 and 18. During 2017 and 18, 57.6% of the US adults used any dietary supplement in the past 30 days, whether male or female. Percentage of adults using dietary supplements increased with increasing age. That's in the 60 and over, that is in the light green. More than 80% they used amongst the females, and more than 67% of the men they used either or combined dietary supplements, whether multivitamin or supplements, and combined together 74.3% they consumed or used supplements, dietary supplements. Dietary supplements, as you can see in this figure, was higher among the women than in men in all age groups. These are women, and this is among the male. This is the second figure. Number of dietary supplements used by adults aged 20 or above by age. This is 60 and over, 40 and 59, 20 and above. In this figure, one can see from 2007 and 8 through 2017 and 18, the percentage of adults reporting dietary supplement use increased in all age groups. This is the figure number 3, which states that multivitamin mineral supplements were the most common dietary supplements used by adults in all age groups, followed by vitamin D and omega-3 fatty acids. Mineral and vitamin D use from the age 20 to 39, that was 24%, whereas in above 60, multivitamin use that was also increased. Vitamin D use was also increased. Omega-3 fatty acids, they were also increased, as calcium and vitamin B12. All these above 60, their use was increased. This is the next figure. Trends in age-adjusted percentage of adults aged 20 and above who used any dietary supplements from 2007 till 2018. It's clear for all ages dietary supplements use was increased. Study was published in Pakistan Armed Forces Medical Journal about multivitamin and supplement use among general population of Rawalpindi and Islamabad. That study was conducted from January till April 2022, and results were only 41% of the people were prescribed multivitamins by their doctors. while 59% were self-medicated. Prevalence of multivitamin supplementation among the population was 66.9%. And what was the conclusion? There exists a high prevalence of multivitamin use among the twin cities of Rawalpindi and Islamabad. Most of the population had awareness of what vitamins are, or essentially half the population didn't know the harmful effects of the vitamins. Males had more awareness of multivitamin supplements as compared to their counterparts. Use and sales of multivitamins and other supplements is on the rise, and they have not been affected by major studies with null results. US supplement industry continues to grow, reaching $28 billion in annual sales in 2023. Similar trends have been observed in the UK and other European countries, and their use is similar in Pakistan as well. He's Lawrence Apple, professor of internal medicine at Johns Hopkins. He's presently working as director of the Johns Hopkins Well Center for Prevention, Epidemiology, and Clinical Research. He's a famous person, and he was a lead in research that concluded the DASH diet, that is, dietary approach to stop hypertension. Lawrence J. Apple says pills are not a shortcut to better health and the prevention of chronic diseases. I don't recommend other supplements. If you follow a healthy diet, you can get all of the vitamins and minerals you need from food. Other nutrition recommendations have much stronger evidence of benefits. Eating a healthy diet, maintaining a healthy weight, and reducing the amount of saturated fat, sodium, and sugars that you eat. Before I say goodbye from the platform of my Margalla Calling YouTube channel, kindly see my next take on the same topic that was published in New England Journal of Medicine. This is a recent review article that was published on March 5th, 2025, in the same month. That was on micronutrients assessment, requirements, deficiencies, and interventions. This will highlight their use in deficiencies in pregnancy, in children, in elderly. Kindly wait for the next episode. Thanks.